Everyone, I'm Dr. Aarathi Bellary, Senior Consultant Physician at Specialty Clinics and Neurocenter. May 3rd of every year is celebrated as World Asthma Day. As we all know, asthma is a disease which can affect children and adults equally, and this is some disease which is there for lifelong, but if kept under control can prevent a lot of future complications. Over the next 4 to 5 minutes, I'll tell you some myths and facts about asthma, what we need to do. This year, that is 2022, they have labeled the theme for World Asthma Day is to bridge gap in the care for asthma. Many a times, how do we bridge gap? We can bridge gap one by creating awareness about asthma, how to treat it, what are the treatment options available, when should you go to a doctor. Knowing more about asthma and creating awareness about asthma can help us to bridge the gap between the treatment, and closing all the gaps in asthma care can be done. So from my end, I will be talking about asthma. Actually, what is asthma? Asthma is a lung disease. Basically, the airways which are there in the lungs, when we breathe in, the air goes to the lungs through the airways. What happens in asthma is there is narrowing of the airways. Because of this narrowing, the amount of air you take in is not reaching your lungs, thereby causing difficulty in breathing. Patient can experience difficulty in breathing, can produce sounds which is called wheezing. It's like a cat scratching disease, like wheezing. Next thing is there can be chest tightness. On little exertion also patients can develop breathing difficulty. That is wherever there is narrowing of the airways, that is called as asthma. Not all the narrowing of the airways are called asthma, but it can be diagnosed when doctor sees you, and then he might do pulmonary function tests and can label as asthma. So but the common symptoms is there can be cough, breathing difficulty, and chest tightness. And usually asthma can be seasonal as well, that there could be triggers that in some seasons where there's a lot of pollution due to the rains, or some change in season itself can cause wheezing, and that time also patients can develop an exacerbation, that means worsening of asthma. As we all know, asthma is a disease which cannot be cured completely, but can definitely be kept under control. So some myths I want to break. The first and foremost is a lot of children, because this is life-threatening if they are not identified, if they are not treated on time, children can worsen. But asthma, many parents, because the patients need to use inhaler, they may say that we don't want to use the inhalers and we want to get out of this. But using an inhaler can be life-saving. So many parents think that it's a childhood disease. The patient can outgrow this, there is no need for treatment. But mind you, that's a myth. So you can outgrow, your lungs will increase in size as you grow. So your symptoms may be less, but you can still develop an exacerbation at any time. So it is good to be under care of a doctor. If they prescribe an inhaled corticosteroid to keep the disease under control, it is very much recommended that you do it. Second, so you don't really outgrow, you can develop an exacerbation at a later stage in life. So please be watchful and understand that. Second thing, usually if I have asthma, then I cannot exercise. You're not allowed to exercise, so it can worsen. So that is not correct. Again, that's a myth. Patients, a lot of sports persons are asthmatics. They use inhalers regularly to control the disease and to relieve during symptoms. And you can definitely play sports and you can do all that. You can live as a normal human being even with asthma. And third one, nobody requires treatment. Like I said, most diseases like asthma, we have in the treatment, there are two components to treatment. There can become an acute exacerbation. That means you have an underlying baseline asthma. Sometimes it can worsen. That can happen when you go in the form of pollution, when there's a lot of air pollution, or when you expose to some sort of fumes, or any area which has some dust, and those things can worsen. Third thing is there can be an infection which can worsen. So you develop a respiratory infection like an upper respiratory or a lower respiratory tract infection. That can worsen asthma. And like we saw even in COVID patients, right, they had worsening of asthma. Because their baseline disease is there, any infection can worsen. So infection, being in a pollutant area, exposure to certain triggers, all this can worsen your asthma. So be watchful of this. So from a baseline asthmatic, we see that there can be these exacerbations. So what do we do during this exacerbation? First, we try to see what is the trigger and we try to remove that trigger. Second thing is we treat the underlying cause. For example, if there is an infection, we do it. And if you're doing some activity and these things develop, we try to give you a reliever medicine. Whenever from the baseline, if there is a worsening of the infection, at that time we use something called as reliever medicines. Basically, these are inhaled corticosteroids. The inhalers which we give you will help you. Inhaled corticosteroids and bronchodilators are used as reliever medicines. And the baseline to keep the ongoing, like I told you, asthma is an ongoing inflammation within the lungs. A small inflammation is happening in the lungs. So you also will need a controller medicine in these cases, wherein it keeps the asthma under control. So you have to use these type of medicines. Lot of people think because steroids are prescribed and lot of them don't want to use the inhalers, they tend to pop the oral corticosteroids. Especially in rural population, we see that they are on lot of oral corticosteroids. That's not the case. You should not be using them without the doctor's recommendation. Try to use the inhalers regularly and keep the disease under control. So another myth people have is this is infectious. We should avoid meeting these people. Asthma is an inflammatory condition of the lung. It does not spread to others. It is not infectious. So these are some of the myths, and I hope you understood what's the importance. In children especially, please seek treatment. We see a lot of parents denying treatment for the scare that they need to use inhalers for a long time, but that is life-saving and it should be used. And do your bit, exercise regularly, do regular breathing exercises like pranayama, because those increase the lung capacity. You can do them, spend a lot of time in the lung spaces, and in general for the community's sake and for the thing, quit smoking and have a nice place with less pollution. Try to create and within yourself stop the pollution what you create. So if all these factors are done, asthma can be maintained without patient actually needing hospital admissions or any other complications which arise out of it. So with this small awareness video, I would like to pledge that let's close all the gaps in asthma care, understand the disease. We are here if you have any queries regarding the asthma, and we are here to help you out. If you have any queries, please do leave it in your comments and I will be happy to answer. Thank you so much, and let's bridge the gap for World Asthma Day.